So I'm going to talk today about the effects of health reform on the federal budget. As I hope you know, the Congressional Budget Office is an agency of the Congress. We are about 250 people, of whom about 50 have been heavily involved in working on health analysis over the past several years. We provide information to Congress about the effects of alternative policies they are considering. We do not make recommendations about policy. The decisions are, as they ought to be, those of the members of Congress. But we try to help them make those decisions by offering our judgments, our evaluations of the effects that are likely to follow from policies they are considering. We do this in a completely nonpartisan manner. We are not rooting for any particular sorts of health reform or against any particular sorts of health reform. And we have worked on proposals sponsored by members of both parties in both the House and the Senate. My plan today is to talk briefly, to review the estimates done by the Congressional Budget Office and the staff of the Joint Committee on Taxation. Our work with on health reform has been collaborative with them. Then I'll discuss some of the challenges that I've heard about those estimates. Nothing I'm going to say today is new. That's sometimes maybe an odd way to start a talk. You maybe come to hear something new. But I want to be clear up front and throughout that I'm not introducing any new numbers. We have not changed our estimates. We have not done additional estimates. I want to just talk through the points about our estimates that we have been making over the last year or more. Okay, so what did we say? So CBO and JCT estimated that over the 2010 to 2019 period, the underlying health reform law, the one that was passed by the Senate at the end of December, and the subsequent Reconciliation Act that modified it, will generate changes in direct spending, entitlement spending, and revenue that will reduce federal deficits by $143 billion over those 10 years. The effects on the deficits of the main elements of the legislation are as listed on the slide. Extra insurance coverage will have a net cost of nearly $800 billion over that decade. Other health provisions will save about $500 billion. Those are principally reductions in Medicare spending relative to what would happen under the preceding law. Then about $400 billion of extra revenues are raised. And then there was $20 billion of deficit reduction from the education provisions, actually quite a significant change in federal education policy, but I will not talk about that here.